Hey everybody, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we have got exciting acquisition news. Oh yes, we have Kyle Armbrester, the CEO of Signify Health, which you may remember went public a year ago. We're going to talk about that in a second too. But the more exciting news is today he's announcing the acquisition of this lovely lady's company, Caravan Health. So please meet Lynn Barr. She is the founder and chairwoman of Caravan Health, and we are going to dive into all of the details of this big acquisition, $250 million in cash and stock in Signify Health, plus some performance-based incentives up to $50 million afterward. It's so great to have you here to talk about this news.
Hey, Jess.
So exciting. So exciting. Lynn, it's so nice to meet you. And I think I want to kick things off right here before we get into the details of the deal. But why don't you introduce us to Caravan Health? Because, I mean, you're a new face. This is a new company to me. Tell us what you guys do.
Thank you so much, Jess, and thanks for having us on your talk today. So Caravan Health was formed in 2014 to help safety net providers participate in value-based payments. We started off with one ACO in 2014 with 12,000 lives and found this was a whole lot harder than it looked. We decided to spin out a company that would then support providers in this journey. And today have more than 200 health systems that are under our management, more than 500,000 Medicare beneficiaries. So awesome. It's been a really exciting journey.
That is fantastic. Well, congratulations on building that business. Kyle, tell us what you saw in it and how this is going to augment what you're doing over there at Signify Health already.
Yeah, absolutely. We kicked off after the IPO, which we celebrated with you, as you said, almost a year ago today. We kicked off a pretty extensive market scan for assets. We raised a lot of money in the IPO, and we've always been, forthcoming that acquisitions were top of mind for us as we wanted to continue to expand our footprint and take more folks into value-based care. And so we looked far and wide. We looked at different models. We looked at different organizations. And after that, nearly year-long process, we found Caravan Health, and it was a match made in heaven for us, both culturally, from a tech and data standpoint, and from the mission of the organizations and what we're trying to do. First and foremost, we're focused on helping to save the Medicare trust, which is running out of money. Everyone in this country should be focused on it, in my opinion. It's one of the most critical things that we need to get right over the next several years. And frankly, moving value-centric work forward and getting us out of the fee-for-service morass that I've talked about so many times is top of mind for us as an organization, is top of mind for me as an executive. And we couldn't be more thrilled about bringing Caravan into the Signify Health team.
All right, let's dive into the details of what this is going to do, because one of the things that struck me as interesting in the press release announcing the news was the fact that you guys now, with the combination of the two businesses, have the largest national network of providers who are delivering care in risk-based models. So let's unpack that, okay? Lynn, I'll start with you. I mean, talk about the types of providers that you're bringing into the fold here. I heard you mention ACOs and you're working with ACOs. Tell me a little bit about that part of your business and what exactly is going on there.
Yeah, well, so when Caravan started, we started with small providers. And so we had to learn how to aggregate them and to hold everyone accountable. So people had originally thought of ACOs as these regional structures, right? And it wasn't particularly scalable, as I think we'll talk about later.
Yeah.
Right. And so we looked at it differently. We looked at it from beside the box. Instead of organizing providers based on geography, we organized them based on their similarities. Right, and what they had in common. And so our providers are predominantly hospitals, FQ, and federally qualified health centers. They primary care practices. So they have a lot in common. They're mission-driven organizations, and they have very scarce resources. So how do you make that work? Was really the idea behind what we were doing.
And Kyle, is this a new market then for Signify that you're getting into? Talk a little bit about that. And for those who may not be familiar with the market that you're already in, explain for us how this augments what you're doing.
Yeah, great question, Jess. So we started off as an organization serving Medicare Advantage plans, and we serve many of the big ones and many of the small and medium regional ones across the country. And so we've been great at helping them to take on risk and to manage that better. the next iteration of our business is we moved into the episodes business, right? And as we moved into episodes and bundled payments, we moved into the Medicare fee-for-service book. And so we've created a organization that's serving both sides of the aisle, both Medicare Advantage and fee-for-service. On the fee-for-service side, trying to bring in value-based constructs. All of our clients, both the health plans and the health systems, have asked us as an organization to help them take on more risk. And towards the middle of last year, I would say in particular, beginning of last year, middle of last year, they started pushing us towards an ACO-centric, total cost of care, more population health view of managing patients inside their facilities. That, again, was coming from the health system saying, look, you're doing all of these great things for us inside BPCI-8. You're helping with patient identification. You're helping with post-acute management. You're helping to activate the home as a real site of care. Why can't you do that for our ACO clients as well? And so we did some light extension into several ACOs, made a tremendous impact for those folks. And we were like, great, this clearly works. Let's go out and find the best ACO enablement company in the country that again, aligns with our mission and vision of what we want to accomplish. We work with the existing healthcare system, right? We go in and complement them. And one of the big trends in the market, as you've covered in several podcasts in the past, is the aggregation of physicians inside bigger health systems, right? And how they work with facilities and how they're affiliated. That trend's not going away. And instead of just focusing on the independents and helping those folks, we want to play in the existing arena where a lot of our BPCI clients exist today too, frankly. And so what this acquisition helped us do was expand our total addressable market without a doubt, but brought a more comprehensive service offering that is population level, then bring in episodes when you need a specialist or you need to manage post-acute more directly. And it ties together the home care that we do more than ever, right? Being able to activate the home will help drive shared savings, create a better patient experience. And the fact that we're bringing more lives into this risk bucket that we already manage through Caravan just gives us more scale to drive better utilization and better engagement with the lives that we're touching.
All right, I want to go deep into the tech side of this, the enablement side of this, if we can. So Lynn, I'm going to start with you because I think Kyle touched a little bit on how Signify does it, but I still feel like we can go a little deeper, right, Kyle? But I do want to start with you, Lynn, and hear about what you guys have built over at Caravan that allows you guys to help with this population level management in that ACO environment. Give us some of the details.
Sure. So over the last 8 years, we have developed a suite of applications that help us manage this massive network. I mean, think about trying to manage, value-based care in 200 different health systems at once. Right, that are all different and are all 44 states and Guam, right? And so here you are. So what we did was we took all those applications and we built them into enterprise software called Caravan Coach. And Caravan Coach takes all the fantastic data we get from CMS and from their EMRs, and then drives its workflow automation software. So it drives action. It's written all in verbs. Right? It's not about, let me go look at a report. It's what do you do with that report? How do you use data at the point of care to change the patient's outcome? How do you use data at the management level and the C-suite level to understand and build strategy? And so that our platform, Caravan Coach, allows us, we use it at the point of care. So we have a care module for taking care of patients. We have a track module for tracking your results, including all of the benefits of this program is so much more comprehensive than just population health analytics. Then we have the other two modules. One of them is the improve module that shows them how to improve everything they're doing, and then where they can submit all of their data and compliance information. So all 4 of those modules just drive the workflow that enables that better care.
All right, Kyle, connect the dots to Signify, because I know this sounds, as she's talking, I mean, I'm pretty familiar with what you and I have discussed about Signify Health and the tech underpinnings that you guys have. This sounds very similar. So I like the dots connected. So as you bring in Caravan and their ability to manage an ACO, connect it all the way through to me to the home care that you guys are very adamant about helping to improve.
Yeah, absolutely, Jess. We so very similar construct to what Lynn and team built out. We were focused on, again, the MA plans, and we took an episodic, a bundled based approach. We needed something that covered the whole population, right? Something that we could go in and would be applicable in a workflow tool that would get more embedded into the day-to-day activities that providers were doing. And that's what Coach really represented. And I'll say, one of the most impressive things is we did diligence on the deal. Lynn and team did some acquisitions, pieced together and built out internally this stack. They replaced a bunch of legacy software in rapid time. And you have to ask that's not an easy task.
No, it's not.
So I asked the question very early on. I'm like, why? And then the utilization numbers are so high. It's because of what she just said. They built it in a human-centered way that actually connected with the providers in these organizations. And I give Lynn a lot of credit. She like me, rolls her sleeves up. She went and took a job inside of a health system as an executive to live and breathe it before she pivoted to create this company. And so she operates and starts like I like to design products from a place of deep empathy and understanding. And that's translated really well into Coach. And so we're excited about it, not only from the ACO use case. We think that it's going to be our overarching provider connectivity platform that drives their success in Medicare Advantage and bundles and inside of their total cost of care contracts, ACO contracts as well. To the home, what we now can represent, we can articulate inside of Coach is that they're not alone. This health system is no longer, this primary care group or specialists, they're no longer going to be operating with just the resources that they have in front of them inside their system. With Signify, they've got a helping hand of a mobile network of 10,000 doctors and nurses, hundreds of social workers that are in every county of the United States. And because we're operating in that shared savings pool with them, we're not competitive, right? We're not trying to take a surgery from them. We're not trying to take over an annual wellness visit for them. We're trying to enable them to drive better outcomes for their patients and really push forward this value-centric concept so they can drive more savings and frankly, be more viable. A lot of these health systems, especially in rural and safety net and underserved communities, which is a portion of where, Caravan started, they need to find models to adapt and survive and thrive. And we view it, Caravan certainly does, and we view it as our mission to help push that forward. And it's frankly something I've been passionate about even since my days at Athena, when I helped launch the rural and safety net hospital business there as well.
Lynn, weigh in on this rural hospital focus. And this is just a fascinating part of your background. So, for the audience, we had a chance to chat a little bit before this interview. And I just talk a little bit about how this even came up as an area of focus for Caravan.
Well, so oddly enough, I've done a series of startups in the medical device and pharmaceutical industry, and had gotten to a point in my career where I really wanted to turn to helping providers and to trying to fix the system. I'm very frustrated, I think we all are, with the state of American healthcare today. And I went back to school to get my MPH at 50. It was like I was the oldest person on the Cal campus, and totally enjoyed the experience until I had to do an internship, which was a little frightening, right? As a 4-time CEO. But I was lucky enough to write the strategic plan for the state of California on health information technology and exchange. We convened stakeholders across the state. And you may be interested in this, Jess. What I learned was that the providers did not want to share data. The interoperability problem.
Shocker, Lynn, shocker.
Shocker. It's their proprietary information, right?
Yeah, we've heard it before.
So the Sutters of the world are not going to give you the data to do what we need to do to fix healthcare. So, and that's what I wanted. I wanted the data to try to fix healthcare. So I had one cohort of 65 hospitals in our work that was the rural hospitals in California, and they were all, yes, you can have my data. And I thought, oh my gosh, there's 60 million rural Americans in the United States. If I can convene rural America, we can get the data to understand the problems and fix healthcare. And that was how I started. And I said, well, how am I going to do that? And to Kyle's point, I took a job as a CIO at a rural hospital to go, okay, now what? And then started the work towards value-based care.
No better way to understand that. And I do think there's something to be said about, the rural healthcare experience is very different than the urban healthcare experience. And so I'm sure you've got a lot of learning that you're going to bring to the table here as we talk to Kyle, who's sitting in like like Lower Manhattan right now with the skyline behind him. All right, the big question, you guys, I want to ask, this is the big challenge, and this is like always what we hear about in conversations about value-based models, risk-based models, specifically ASO models, is, oh, can't scale it, unscalable. We've been doing this for 2 decades, can't scale it. How does this acquisition, this big Signify Health that connects Caravan into Signify, into the home, and the whole thing, how does this combat that? Like, is this the silver bullet that ends up scaling ACOs and risk-based models across the country?
Yeah. Well, I certainly hope so. One of the things that we discovered, so in 2017, I was operating 38 ACOs. I had 38 quarterly board meetings. They were all had about 10,000 lives, right? It was driving us absolutely insane because the results were going up and down, up and down, up and down, very unpredictably. And we analyzed the performance data and realized you couldn't do an ACO with the way the program works without less than 100,000 lives in your ACO. Well, how many ACOs have 100,000 lives? No, about 10, right? and 80%, and 4 of them are ours. And 80% of ACOs have less than 20,000 lives. That is not scalable. The only way you can take risk is to have, what does every insurance company know? You have to have scale. And so having a system with, the first part was creating a system where you could get everybody to do the same work and you could hold everyone accountable and measure that and have a program and a governance and to make that work. So that was step one. But I think what Kyle brings to the table and Signify brings to the table is really that bigger, broader vision. And I'll turn to Kyle to have him fill in.
Add on.
What
The give and the take is great, you guys. I see how this unfolded.
I would say, just to re-emphasize the point, the Caravan coach, we're super excited about it. We're excited about the team. They've done so many innovative things, but this model, being a network of networks, okay, what they pulled together, this taking folks from all across the region or an area and bringing them into a larger collaborative ACO construct, it is really the linchpin of what the team has innovated on and why we're so excited to scale the business out. It's given a pathway for folks who might not have access, to Lynn's point, to value-based care, to be accessible, to have an opportunity to participate, and then to really perform, because we wouldn't have bought a company if it wasn't really driving shared savings, and they wouldn't be in existence because they're in the risk pool with folks. And that's really important to me, as a leader, and important to us as an organization. What I think we do beyond that is really 2 things. One, these ACOs still need help and support. They need services that can extend them into the home. They need more data and analytics. They need help with the post-acute. They need help with providing comprehensive evaluations or doing advanced care planning initiatives, right? So there's a whole battery of services that they're understaffed for. There's a physician and nurse and a medical professional staffing shortage across the country, right? A big thing that Signify does for our existing health plans and health systems is round that out with our nationwide network and scale. And so we're going to be bringing this to all those communities. And I couldn't be more excited for them to feel like they have a helping hand, day in and day out, that's watching and standing right alongside them inside those risk pools. So that's number one. Number 2, and this is a little more nuanced, but one of the biggest conundrums in healthcare is you have a big payer, CMS, right? And they have their own initiatives, their own programs, and they're running them. How they can translate those into a true multi-payer system where the big health plans and the regional health plans exist, it hasn't worked today. They've got Medicare Advantage and other things, but specific programs outside of that haven't achieved real, nationwide scale. When Signify now shows up through this Caravan acquisition, we are bringing something that is genuinely multi-payer, because we already have the payer relationships and we've got a big CMS relationship. And so instead of working on eligibility and figuring out is Jess and MA and is Lynn and Medicare fee for service, we can run a 65 plus, program for everyone that's in Medicare that's doing these same jobs to be done. Better care, focusing on care in the right location, ensuring that they're getting their meds and other things cleaned up. If they need home-based care, activating that. And so we're breaking past this eligibility barrier that's total chaos in this country and leads to disparities, frankly, between those two systems that I just mentioned and the care that individuals get. And it's hard for them to navigate. We're going to wipe all that out, right? We're going to provide one healthcare system for everyone when they show up, and that's the ultimate focus of Signify and what we're trying to do. And we couldn't be more excited about this major milestone step with Caravan taking us alongside that journey.
Absolutely. It's like, forget this
Got me all
issue
fired
of,
up. Yes.
forget this issue of scaling. We'll create our own scale. Like, I love it, Kyle. I love it. All right. Last thing for you, since I got you all fired up, we cannot leave this interview without acknowledging the 1-year anniversary of the IPO. And so I want to know, like, a year in, what's been more challenging than you expected it would be? And what's been easier than you thought it would be? Tell us that, and then we'll end it.
Yeah, no, it's great. I mean, I'm in the same spot, ironically, that I talked to
You are.
same computer, same everything, almost a year ago. It's been a wild ride. It's been fantastic. Our number one goal with the IPO itself was to get our message out there, right? But to also raise some money so we can do innovative acquisitions like this. So it's been wonderful in that regard. We brought in a ton of new talent. We're expanding to multiple geographies. We've been able to really go out and tie our strategy and bring in folks that are aligned with our mission and vision, and the marketing and advertising that goes around the IPO process. It helped more people understand what Signify does. What's been challenging is there's a lot of additional overhead that comes with being public. So I've got a lot of other taxing things on my time, the team's time. But what's been great is we still have our single largest shareholder. So I haven't sold a share, New Mountain hasn't sold a share, and having that partnership in there with our great public shareholders who've come along, it allows us to execute our vision and mission for where we want to take the company. And New Mountain, Lynn met them. They were in this process with us. They've been a tremendous partner. And so, we're a hybrid in that way, that we have a big shareholder that's still deeply engaged. And it's worked out very well for us throughout this past year.
Yeah, hang on to your New Mountain Matt Holt. I've got to meet him.
He's ready.
I've got my own Matthew Holt, but yeah, hang on to yours.
We've got to do a face-off.
He's a little better capitalized than mine. All right, well, this is exciting, Kyle. I mean, I know you guys have had a big year. I mean, you and I have talked about the new Medicare plan that you helped launch at the state level. It was Connecticut, wasn't it?
Yep.
In the state of Connecticut. We talked about your partnership program, lots of big things happening. And so it's exciting. And then to really put a big exclamation point on the end of the first year with this acquisition of Caravan Health is tremendous. So congratulations on that. Lynn, welcome to the Signify Health family, I guess.
Yeah, we are delighted. I mean, it's an amazing team, and New Mountain is a visionary organization. And we are, I have more hope for fixing healthcare today than I ever have before, because what we can bring to the table is a single, as Kyle said, a single system. It's what our providers want. They just want one way of taking care of their patients and to get rid of all this noise in the middle. And we together, we can bring the payers and the providers together. So hopefully there'll be one system of care for all patients, and that will really change the trajectory of this country.
Awesome. Let's leave it there. Yeah, let's leave it there. Thanks you guys so much for coming by and letting us dig into the details of this acquisition. It sounds really exciting, and it's just the ability that you guys have now to achieve that scale so you can do some other really innovative things. Lynn, I hear you're going to be the new VP of Innovation in Signify Health. So we'll see what you've got up your sleeve for us next time. Thanks again for joining me here, you guys. It was a pleasure to speak with you both.
Thanks, Jess.
All right. For more interviews with those who are changing the way that we do healthcare, check out my YouTube channel. It's at youtube.com/WTF Health. Big thanks again to Lynn Barr of Caravan Health, which just got acquired by Kyle Armbrester's company, Signify Health. Thanks again for joining me, you guys. Take care.
Thanks, Jess.